We'll start with a brief history about how Good Samaritan Health Centers of Gwinnett started. We were created in 2005 out of a church, a local church, who saw the need in the community for people who were uninsured, who didn't really have access to health care, and who just couldn't afford primary health care in the United States. It's just really expensive. We opened our first location on Club Drive. It was a very small office, very limited parking, and we could only see, and at the time it was a volunteer clinic. So we operated at that time off of full volunteer staff, very few hired staff, paid staff. But we realized that this venture was just growing. The need in our community was so huge for medical and dental care that we had to expand. And we had to change our model. It's very hard to run a practice giving everything away for free and using volunteers. Volunteers work when they can work, when they're available, or when they want to work. We needed to hire staff to make this available to our community all the time, whenever they needed it. So we went to a self-pay model, and what that means is we are still nonprofit. We offer very low medical and dental fees to our patients. But they do pay fees. It's about 50 to 70, it depends on what they're having done, 50 to 65, 70% less than private practice. We are the largest provider of medical and dental nonprofit services in Gwinnett County and one of the largest in the state. We offer several services, full medical care. We have two fully functioning medical clinics and two fully functioning dental clinics. We also have biblical counseling available for anyone. We have specialists who come in from time to time, OBGYN, podiatrists, many specialists who will come in and they will volunteer their time to help to see some of our patients who need that care, but we don't necessarily have that in-house. So that's where we started. We are very committed to help train and develop the next generation of healthcare providers. We are a training facility and always have been. We have, as you see, all of the places here listed, we have relationships with them. We take externs from many of them, externs for nursing, externs for nurse practitioners, our PAs. And some medical assisting externs we have always taken. So we have a great reputation in Georgia, especially in the Atlanta area, and great partnerships with businesses who want our medical assistance because they know how well we do it. And this is a little sample of the workforce. And I think, Lakeisha, I think this is where you take it up. Please stop me if I say
Yes,
something
ma'am.
over.
Yes, ma'am. Hi again. I see someone else has joined. I am Lakeisha Crawford. I am the instructor for Access Academy. Um, with Access Academy, part of our coursework you see listed here, it consists of 15 weeks of in classroom lecture and lab. And then the final 4 weeks is your externship. We do every possible chance to get you at an externship that you're interested in, one that's in driving distance or close to particularly where you live. In terms of your in classroom work, we will work on things in terms of lecture. We have MA 101, which deals with the fundamentals of medical assisting, the basic what medical assistants do each day in medical clinics, hospitals, and other medical facilities that you will have a great amount of area to work in as a certified medical assistant. MA 102 deals with medical law and ethics, dealing with HIPAA. What are some things that you would learn in that class would be simply your HIPAA rules, regulations, OSHA, what you can and cannot do in the medical field, your scope of practice. You will learn a lot of medical terminology that will help you in various careers in the medical assisting field, whether it goes into specialty, cardiology, pulmonology, and so on and so forth. You will learn medical terminology. And also, we will deal with all of the basic systems of the body, respiratory, cardiology, deal with nephrology, and so on and so forth. And then you have your phlebotomy skills, where we get into our lab skills that you would learn. You'll learn how to draw blood, how to process blood samples and urine samples, and so on and so forth, to go to labs, outside labs. You also learn how to do injections, EKGs. You'll learn how to triage patients, how to do referrals, just to name a few things. Basic life and employment skills will be your soft skills. You will learn that as well in this program. Resume, interviewing, how to be punctual for work. These are all skills that will help you be successful as a medical assistant. You can go to the next slide. Okay. All right. So our program hours of operation is Monday, Tuesday, and Thursday, and that is from 9 to 2:30. We have a lunch break from 12 to 12:30. Typically, we lecture in the morning from 9 to 12 lunchtime, and then from 12:30 to 2:30 is your lab time. Now, there are days where you would flip-flop that schedule and basically do lab in the mornings and then lecture in the afternoon, but that would just kind of come as the demand for more lab time. However, this is the schedule that we particularly run. Wednesdays and Fridays are days by appointment. For any makeup days, we do stress 100% attendance, because this is and can be a fast-paced program to be in, because it is a total of 19 weeks, with 15 weeks being in classroom. However, we do understand that situations do come up. We just ask for open transparency when it comes down to illnesses, late arrivals, and things like that. But that is what that Wednesday is for. Also, Fridays by appointments, any makeup work, any lab skills where you need to come in and practice a little bit further, those days are for that as well. Okay. So why do you want to become a medical assistant? That's a question that I tell everyone to ask themselves, because the medical field can be demanding. However, if you have the heart, if you have the compassion to help others, medical assisting is for you. It's a very rewarding field to be in. Although, obviously it is a very demanding field, however, it's very rewarding. As a medical assistant, obviously you play a crucial role in the medical field. Various places that I mentioned before, some I did, that you can work in, such as doctor offices, hospitals, nursing homes, and home health care. I have been in the field over 16 years now, and I do not regret it at all. There are so many things that you can do with your medical certified medical assistant certification, as well as go on with that certification to apply for other certifications, such as the EKG tech or a phlebotomist. So there's a wide range of job opportunities, as well as opportunities for leadership roles as a medical assistant. Key responsibilities as a medical assistant will be administrative tasks. Also, you have your clinical, accurately recording and reporting data, recording medical histories and measuring vital signs, which is on the clinical side, assisting with procedures and performing lab tests. And even so much so, to go further into your medical specialties, you will even see that you have other responsibilities that can be very rewarding and exciting to do. All right. So when we ask ourselves that question, why do we want to become a medical assistant? If your answer is you want to make a difference, be on the front line of healthcare and provide essential support to patients. This is a very in-demand career. I cannot see anyone not being able to find a job and have a choice in where they work. The pathway to more, meaning the role can pave the way to careers in nursing. Some of you guys may use medical assisting as a stepping stone until you get to your ultimate goal of being a nurse practitioner, a RN, a LPN, a PA, or even so much so a doctor. I particularly currently have a student that is achieving the goal of possibly becoming a cardiologist someday. So it paves the way for a lot of medical specialties that you can go into and further your education. All right. So, in terms of our healthcare crisis in Georgia, what we found 18 counties have no family medicine physician, 40 counties have no internal, 65 have no pediatrician, 82 counties have no OBGYNs, and 90 counties have no psychiatrists. And as you can see, with that being said, the demand is there. I stated before, you would not have any trouble finding a job as a medical assistant. Most of our offices, some of our other outpatient specialty offices are ran particularly by medical assistants. Most of the individuals that are working directly with the doctors are medical assistants. So it is a high demand for that. And because of this healthcare crisis, we have offices opening up more all throughout the state of Georgia. And those offices will need medical assistants to work there. Okay, I think now is
It's me now.
Shannon.
It's
I'll
back to
hand it
me.
over to Shannon.
Back to me again. All right.
Yes.
What are the expectations of Access Academy? Before you're being accepted, we must get your applications, of course. You must be 18 years old by the first day of class. You must be proficient in speaking, reading, and writing English, have a high school diploma or a GED. You must complete an enrollment application and pay, and there's a fee with that, a $50 fee. And complete, we will do interviews. We'll do an interview with all of our applicants. Just we want to know more about you. I've had somebody ask, does that mean it's hard to get in? Well, yes and no. It's hard to get in if we're only going to take, I'll get into this in a little bit, but these are going to be small classes and that's very intentional. Hard to get in. If we have not met our quota, if we don't have enough people, then we will take people who may not have the correct, maybe have a higher income because this is a nonprofit school. So it's not hard to get in. It is just a matter of we want to know a little bit more about you, what brings you to medical assisting, what your goals are. We want to hear your story of why you're interested in this. So we will do interviews, and in that interview, we'll go over more of the expectations that we have as the academy. And provide verification of household income. Again, this is a nonprofit school, so there is income limitations. We do accept students who have a higher income or whose parents may have a higher income, or maybe they themselves do. But they would be accepted if the class is not full and we have spaces available, then we would accept those students. After being accepted and before the first day of class, you will provide evidence. So once you're accepted, once we've done the interview and we have accepted you as a student, you will have to have a hepatitis B vaccine and a negative TB test. And that is because employers are going to require that. You will be working with patients. And so that is just a requirement of working basically in any medical office, especially in the clinical part. And consent to a criminal background check. Again, many employers are going to want this, and because we will send you to extern sites outside of our office, we have due diligence to do to protect the office that we're sending you to. Not that anybody's doing anything wrong, but they ask that they're going to want it. Well, what are our liabilities and what are yours? We have to do that. During class, you will be expected to wear scrubs because you will be up in our clinic seeing actual patients, working around actual patients. So you do have to wear scrubs. We will tell you the color and give you some ideas of where to purchase them. You can purchase them from wherever you want, but there is a specific color. After each class, you have to arrive to each class and externship on time. Punctuality is very critical in this program. We know what employers expect. So when we say class starts at 9, that means your butt should probably be in the chair at 8:55. I'm old school, so if you're on time, you're late. That's just how I think about it. And we know we've talked with many employers, and we know we are employers of many medical assistants, so we know what we want. Um, Arrive on to externships on time also. And that's because we're sending you to some of our partners who have agreed to take our externships. So that's our reputation. And so we want to send you to an extern site knowing that you understand that you have to be on time and some of those soft skills have to be practiced. Um, Attend every class. We have a 100% attendance policy. You are required to attend and complete all classes. Very few things will be accepted to miss class, and that would probably be like a death in your immediate family. Of course, if you had the flu with 103 fever, we can't have you in class, but very few things will be accepted as an excused absence. And that is because, as Lakeisha said, it's a lot in 19 weeks. You're going to get a lot of information. And if you miss Monday's class, then on Tuesday when you come, you've got to not only do Tuesday's class, but you've also got to make up Monday's class. So it gets really hard. It's kind of a snowball effect if you're not in class all the time. You must maintain a B average in each course. And that is because, again, we have high expectations of our students. We know very well how to train medical assistants. We know, and we don't want to be like other schools who accept a 70 or 75. We want you to be the best medical assistant you can be. Um, and arrive with a professional and ready and willing attitude. And that's because you're going to encounter some of our employees in the office. You're going to encounter patients in the office. So you have to just know to be very professional at all times, watch things you say in certain areas, and be willing to step in wherever somebody says, hey, you want to come learn this or do you want to do this? The big question, the cost of attendance. So it's a $50 application fee. So if you want to apply, you'll fill out the application and pay $50. It's $2,500 per student for the cohort. Most courses we've checked into them in the area are anywhere between 11 to 15, $16,000. So ours is only $2,500. And you can either pay that all up front or you can pay $500 a month. We also accept a firm. So if you have an account with a firm or want to look into that, we'll accept that also. And scholarships are available for students who need help with their tuition if funds are available and if the students meet certain criteria. It's just kind of, we have donors, very generous donors who have said, I want to provide scholarships for students in need, or I want to help students who can do some of the tuition, but not all of it. So we do have that available. Books and scrubs. So you will be purchasing your own book, your scrubs, blood pressure cuff, and stethoscope before the first day of class. We don't add that into the expenses simply because we're not collecting that money from you. You will be paying that yourself. Scrubs, blood pressure cuff, and stethoscope. Lakeisha always sends out the color, gives you a good idea of where we have found some really good quality stuff at lower prices, but you can certainly buy whatever you want. She's just going to tell you what the colors and the requirements. The book is an online book. On the first day of class, you will be purchasing that book and have access to it for the course. Certifications. Lakeisha, do you want to take this one? This is more your thing.
Sure. All right. So as far as the certifications are concerned, we have certified medical assistants or certified clinical medical assistants. Typically, most of the certifying bodies that we use, NHA, National Healthcare Association, is one of them. And they are accredited by the Commission on Accreditation of Allied Health Education Programs. along with accrediting Bureau of Health Education Schools, ABHES. These programs also, for example, NHA is one that you can actually test for your phlebotomy certification as well as your EKG tech certification as well. We're not the testing site, particularly for these certifications, but with your completion of the program, it does give you the certification that you need to sit for these exams. Typically in the state of Georgia, and I've also taught in the state of Alabama and Texas as well. The NHA is one, the AMT, which is the American Medical Technologist, is one that's recognized. But in terms of what certification, CMA, Certified Medical Assistant, or Certified CCMA, Certified Clinical Medical Assistant, is the certifications that are most recognized by all three states that I mentioned. But you also have, obviously, you can do the registry, which is a registered medical assistant certification, RMA. And then you have the National Certified Medical Assistant, NCMA, which is offered by the National Centers for Competency Testing, which is the NCCT. So with these certifications, once you complete the 15 weeks of in-classroom lecture and lab, and then you do the 4 weeks of externship, at that point, obviously, you will be granted your certification upon passing of all courses and externship as well. And then from there, you will sit for your certification exam.
Thank you, Lakeisha.
Sure.
Okay, externship and job placement. So after 15 weeks of in-class and labs in the clinic, you will do a 4-week externship. And that externship, sometimes it's with us because we do have two fully operating clinics. And sometimes, as Lakeisha said earlier, it's with an outside clinic. And we try to do that based on your location, based on your interest. If you're interested in women's health or OBGYN, we have an extern site for that. If you're interested in pediatrics or something like that, we want to have all the extern sites give you that opportunity to say, I want to try this. And so we try to match that. We can't always, but we try to match that with our students' interest. We'll provide assistance with obtaining an externship with someone in our community. So you're certainly able to go to find your own extern site if you have an office in mind, like this office has told me I can come do an externship with them and I want to. We just have to know about it, and we have to kind of go vet them, make sure that they are agreeable to our terms, make sure that, they understand what we expect, and that is not for you to be shadowing and just watching people work. We literally want you to work in their clinic. So if you have somebody, we're certainly willing to go visit and make that partnership with them. We'll also provide assistance with job placements. We cannot say that we will find you a job, but we're certainly going to help you with resume writing, interview skills. That will be done in the soft skills part of the class, the last week of class time. And we'll follow you for 1 year. We want to follow you for 1 year to see, first of all, are you adjusting well? Do you still have any questions or anything else you might need assistance with? We're going to tell you, maybe we have leads on jobs. Try here. I know that these people are hiring a medical assistant. We're going to help you with that and just see where you're going for the first year and what, how you feel about it and what you think about it. And then again, you'll be asked to name your ideal extern site location based on your interest and availability. And some people want to do stay with us and do primary care, and some people want to go to specialties. So we try to have all of that available. Questions and answers. So I will say, before we get to questions, I just want to say that we have been teaching medical assistants for many years, but not in this sense. We didn't have a school. We've always taken and trained people with zero medical assistance from our own community and trained them from the floor up. We have also taken externs from other schools. And what we found, and the reason we started Access Academy, what we found is those students from other schools, they were generally online courses. And so they were not prepared. They were very ill prepared. They had the book knowledge, but they did not have the hands-on skills. They did not know how to draw blood. They did not even know how to take a manual blood pressure. And I'm telling you that most doctors want that. Yes, the machines do it for us these days, but most doctors will tell you they're not always accurate. And in a pinch, I want the students to know how to take a manual blood pressure. So and when we had students come to us, they just did not know. They were doing classes online. They didn't have the hands-on experience. So we intentionally made these classes in person. So it will be in person 3 days a week. And then your externship will be basically 40 hours a week for 4 weeks. So it does take a commitment. There's a little bit of time that you're going to have to commit to that. If you're working a full-time job, you may have to make arrangements with them to say, look, I want to do this. It's for 5 months. Um, we have our students now are working, but they work on the weekends or they work in the evenings or they work on the days that we don't have class. And I promise you that once you do this, if you make this commitment, you will not regret it. You will be glad. But we intentionally will never have more than 10 students per class. And that is because we firmly believe that you need the hands-on experience. You need to draw blood from an actual person. You need to do an EKG on an actual person. And you need that face-to-face contact, asking questions to patients and hearing their responses and objections that you get. That's how you learn to deal with those. So it is a commitment for this course, but we're fully committed we want to get each student to where they want to be. And that's why we're keeping the classes small so that we can give that attention. And Lakeisha is great. Her students have already told me, like, she's wonderful. She's there basically every Wednesday. If somebody needs extra time or they like, I just want to practice a little bit more on this skill, she is there for them. And so that's why we are doing this, because we believe and we know our medical assistants that work for us are wonderful. And we believe that we can give others the opportunity to go earn a good wage, and learn a new skill and grow in this career. This is a career I started as a medical assistant many, many years ago. I am now a manager of a medical clinic, a large medical clinic, and running the school. Lakeisha started as a medical assistant. She's teaching. So there's so many things that you can do in this field.